Hawaii could soon see between $1 and $4 billion in federal relief money in a compromise bill that's finally coming close to a deal after months of disagreement in Congress. And the money could help stave off teacher furloughs. Gina Mangieri reports.
With CARES Act money and other federal relief running dry this month, a Hail Mary at the nation's capital might come together this week.
It'll be somewhere between $750 billion and $900 billion nationwide, which will mean that Hawaii will see somewhere between $1 and $4 billion of additional relief.
Relief in some critical areas that helped Hawaii's families and small businesses tread water through a treacherous 2020.
We want to extend the PPP program, the small business program. We want to extend unemployment insurance. In the proposed compromise, there's also a lot of money for vaccine distribution and rent relief, not just forbearance like in the previous legislation, but actual cash for people to pay the rent, and money for lower education, K through 12, and higher education.
A broader deal for state and local government funds may be carved out for later negotiation, but I asked, would the education money in the compromise relief bill be able to stave off Hawaii's public school furloughs?
The current draft of the bill allows the money for lower education to be used to pay teacher salaries. So it'll certainly help in terms of the DOE's fiscal situation and should help them to avoid, these worst case scenarios that we're really looking at as early as next month.
It's not yet known if another round of direct stimulus checks to families will make the final cut. The current draft does resolve a big small business worry, whether expenses offset by PPP grants will be allowed to be tax deductible.
The current draft has that issue resolved and fixed. So we would have full deductibility. So that issue looks to be solved, again, as long as we pass a bill.
And passing the bill is still the tough part. All summer and fall, lawmakers in Washington have said they know Americans need more relief, yet no deal's been sealed.
We now have agreement between Mitch McConnell and Nancy Pelosi and Chuck Schumer, Democrats and Republicans on the House and Senate side, that we simply must pass a compromise bill.
Gina Mangieri, KHON2 News, working for Hawaii.
5 employees at Queens Medical Center became the first frontline workers in the state to receive the COVID vaccine today, marking what some call a turning point in the fight against the virus. The Queens employees volunteered to be the first to get vaccinated, and they'll be monitored for side effects. More hospital employees will be vaccinated tomorrow.
I think because this is under emergency use authorization, that everything is going to be tightly controlled and they want to know all the symptoms. It's part of getting the full FDA approval.
There have been times where we're at our patients' bedsides holding their hands when it should be their families and loved ones with them. We've seen the detrimental outcomes of what this disease does.
Health officials still don't know whether a person who has been vaccinated can carry the virus and infect others. So officials are urging the public to continue wearing a face mask and social distance. Even though the vaccine is here, it could still take months for most people to get it. The first phase of the state's vaccine plan is broken down into 3 parts: 1A, 1B, and 1C. These include medical workers, other essential workers, and the elderly. Lieutenant Governor Josh Green says he hopes to reach phase 2 by February or March, and that will include those with chronic illness. But Green adds there are talks to include populations impacted harder by the virus.
You want to focus on the people that have the highest mortality rate. You want to bring that way down because then you have extra hospital capacity.
Mass vaccination sites and pharmacies could be ready by May or June for those in the 3rd phase. That will include young children, young adults, and low-risk individuals. He adds 70% of the state's population would need to be vaccinated to reach herd immunity. According to the CDC, after getting vaccinated, you may experience some side effects, which are signs that your body is building protection against the virus. Side effects are similar to flu symptoms like chills, tiredness, fever, and headache, and the CDC says they should go away with